Hello, so my name is Michael Awood. I'm from UCT MedTech and welcome to our stand. So we are from the Biomedical Engineering Department and we've got quite a few technologies that we focused on. I don't even know where to begin with some of them, but we're going to take you through just one or two that I think are really important. The department focuses quite a lot on translational research. How do we get technologies into the public space? And a lot of the tech is influenced by medical devices. A lot of the tech is influenced by clinicians who represented a need for the medical devices. So something that we have in front of us here is a 3D printed prosthetic arm. And this prosthetic arm comes as a need that currently in the Department of Health, there's not that many prosthetic arms available. We're talking in about the tens of thousands rands that prosthetic arms cost. They do fund quite a bit of lower limb prosthetics, but it's also try to understand what could we do differently in the upper limb space. So what we have on offer is a 3D printed upper limb arm called the ADL arm, the Activities of Daily Living arm. And this arm, completely 3D printed. The only parts that aren't are obviously the nuts and the bolts, some of the fishing wire as well. But if you imagine a world where someone has a congenital abnormality, they've had a transradial amputation, this device fits onto the arm, much like that. And when you flex your elbow, the device closes. And essentially this will allow someone to perform very basic activities where they can pick up objects. The whole point of the arm was how could we produce a low-cost device that provides function. It's not just something that looks good. So we really pride function first and foremost, but then moving into form. So this is the ADL arm, something that we're looking to trial within the national space, and we do have a potential partner that we can work on with regards to that. A couple other devices that we have, sticking with assistive technologies. So I'm an occupational therapist. I work with a lot of people with disabilities. I'm out of practice for now, but we've been focusing a lot on what are the clinical tech and the clinical information that I bring from my side. Another one is the ptosis crutches. So these are these little black objects that are placed on the clipped onto the frames. Ptosis is whereby there's a weakening of the eyelid or the drooping of the eyelid, and this happens for people with neurodegenerative diseases, much like myasthenia gravis. And what happens is the eyelid droops quite a bit, and they need something that can hold the eyelid open so they can participate in the activities of daily living. I had to put this on. You probably can't see it quite nicely, but it actually is to lift my eyelid up. And that's the purpose of this, is just to provide something that holds the eyelid up. Outside of holding it yourself, outside of putting sellotape on your eye to hold this up. So these small devices don't really cost that much. They're 3D printed, with a little steel piece at the bottom. We self-put them together. We've shipped these out to more than 10 countries so far. We actually just shipped a handful out to Namibia last week or 2 weeks ago, because there's still quite a big need for it. Technologies, as I said before, is about getting it to the people that need it the most, trying to make the impact on the healthcare system in that space. So a lot of what we do is guided by healthcare, guided by the clinician, but trying to create the impact for the person that requires it the most. Some of the other innovations that you'll find here is quite a large one on my far left. And there's a bit of a story with all three of these devices. So right at the bottom, and you can see there's a nice CSIR logo on it. So it was part of the National Ventilator Project. And it was one of the tools that we were funded for to assist with creating a national ventilator. So that comes out of that project. So UC Vent, the UCT ventilator, UC Vent, comes out of following on from that project. Could we create a medical device? Could we create a ventilator that would work within these hospital settings? So we're able to, this is our software that we've put onto it. This is a 3D printed casing, holding everything. The parts are normal parts that you'd find in ventilators, and as you can see, it's busy inflating the bag. So This is a ventilator that we created in-house with some funding resources as well, but it's something that we've now proven we can make these types of devices and we can put them into resource limited settings that need access to very crucial technology such as this. The one just below that is the Inspire device, kind of born as a second part to this. And Inspire looks at CPAP or sleep apnea as well. So sleep apnea is a large proportion of people undiagnosed with sleep apnea, and this device provides CPAP, so continuous positive airway pressure, which holds the airways open when one sleeps. So usually outside of that, if you have sleep apnea, you stop breathing at random parts in the night, which can cause other healthcare difficulties that you might experience. And Inspire was then created as a way to address this issue, to create something that provides that level of support. Inspire is also looking to take it a bit of a step further by having a telemedicine model added to it, where the doctor is actually able to see all the information from the patient in real time. It's looking to assess them and tell them what's happened, but at the same time provide the right level of clinical support and assistance to ensure that they are being titrated or treated for their sleep apnea needs in tandem. So the Inspire is a very powerful device that's come quite a long way. Some of the other devices that we have here, we've spoken about this quite a bit today. This is the Easy Squeezy device, coming from a company called Impulse Biomedical. Their name is up on our board on the side there. And while I'm there, Kaya Health Tech is the company that created the Inspire device. We'll come to VAS MedTech just in a little bit. But speaking back to Impulse, Impulse looks at these Easy Squeezy devices. This is a child's pump and looks fairly simple to use and quite easy to use. But a child trying to press this, and I'll emulate that by using my small finger and my thumb, it's very difficult to press that to get that to actuate. And what they've created was the Easy Squeezy, which allows you to actually press and activate the pump at the same time. So it's able to use the force that the child is able to push out to actually actuate a pump, therefore promoting independence, but also it looks like something fun. There's a character that's a collectible. It even has a metered dose counter, so you know where you are, how many pumps you have left. And this has actually gone into a much bigger process. There has been significant interest in it, and actually looking to see how it works out within the pharma world coming quite soon. So this is one of their devices that they've created, and they've also made a ZB-Pen device, which is looking at an intramuscular auto-injector for things such as epinephrine. The cost, again, a lot of our devices focus on how do we reduce the cost and access to essential and effective healthcare technologies. And the ZB-Pen is one such device where you can reload this device. Your usual EpiPen, you are unable to reload them. You have to buy a whole new pen per time that you need it. But this, you're actually able to reload. The device cost, therefore, is negated in such a way. So ZB-Pen, and there's a new version that is loaded, and we won't play with it. We don't want to create an accident for ourselves. So we have that, and then we actually do have, I said we'd come to the last one, which is VAS MedTech. VAS MedTech created this device called the Flexagyne, and the Flexagyne is looking at how do we create a space for accessibility in women's healthcare, but also created that it's easier for them, easier for women to experience a much better consultation when it comes to their health. So this is a flexible scope. The scope can be inserted into the uterine canal with little to no anesthesia depending on the needs, and you can have local anesthesia if needed. But the camera and the device is fairly small enough to fit into the canal, and then still be able to take pictures and look at creating videos of areas of concern intrauterine, and that can be sent back to the clinician. So again, we're trying to optimize the healthcare system here by making sure Appropriate screening can be done at a very basic or basic clinic level, while ensuring that the cases that really need assistance, that really need the support, get sent through appropriately to the correct level of care, the correct gynecologist or any other specialist that might need need to step in at that time. One of the other items I actually just left off was the UCT visor right at the bottom. The UCT visor was done again out in COVID, and this was quite a wonderful project that some funding was raised for, and essentially it was just created using some offcut of the see-through material, or the can't get the word for it, but and then we also had I'll take one out actually while we talk about it. There we are. So it just uses the standard face shield material, so the perspex here, and then this is just an offcut from old mattresses and pillows that was then glued onto this. And this again is also offcut material that we had been able to purchase and source. And during COVID, we assembled these, but we assembled these by providing job opportunities for unemployed women. And they put together quite a few of these that got sent out into the various departments, the various hospitals, and various clinics through COVID. And the UCT visors actually, it was fun to see a couple of clinicians come out and say, actually, we've used one or two of these devices. So this is a really powerful project, not just providing our clinicians with safety during COVID, but providing people with opportunities for employment. And it comes in an adult one, and there's also a pediatric version of it with just a very different cover on the top. So we got a couple of more devices that we can chat about. This is a device. It's an open source 3D printed hand. It's called the Phoenix Hand. So the company's called Enable. Their software or their files are readily available online. This is something you can download and 3D print yourself. As we've seen from some of our other devices, they're all 3D printable, besides elastic bands or things like fishing line, nuts and bolts that we use to sort of fixate the device. And this is used for people, again, congenital abnormalities or amputations through the hand. We actually had a patient that we tried assisting with that had a hand accident that led to amputation of some of the digits of the hand. And we could fit this on the person so that they, in wrist flexion, because this device would sit something like that, in wrist flexion, the hand is able to open and close. So they could perform some function using this device. And like I said, this is a readily available device that most people can, or anybody can download, and just 3D print out a size that works for you. So we do pride ourselves on the 3D printing capabilities that we have, as well as what translational outcomes these technologies can have. And then we also have a wrist brace device. This is called the U-splint. The U-splint came as a need for fracture fixations. So if you think of someone at the rugby field or the soccer field, they fall, they get a fracture on their wrist or on one of the arm long bones, and usually what would happen is various ambulance would come out, they'd wrap them up with metal wires and a bandage, and they'd take them to the hospital. The problem is most of our clinics in the public sector are inundated with these types of spaces or with these types of patients, and ultimately you do need a doctor to remove the bands, you do need a doctor to remove the bandaging so that they can x-ray it. You can imagine x-raying something with metal wire and it's not going to pitch up, you can't see the fracture. But sometimes that's what's happening. And a way to combat that was to 3D print a wrist brace that essentially goes onto the arm. It's adjustable for the length of the arm. It's got the instructions printed on it as well. And this can be deployed within an emergency setting. Someone is able to put this on to a person with a suspected fracture. It's radiolucent, which means that on an x-ray it won't even show up, and we've proven that. It can be cleaned as well and sterilized as necessary. And again, this is 3D printed, the cuffs are 3D printed. It's just the Velcro that's not, and maybe some glue. But again, a device that can solve a problem with visualizing where's the fracture. Someone might need to go home, there's not enough capabilities to do an x-ray. They could be discharged or sent home with us to come back the next day. So again, I'll say it over and over again, a lot of our work is about translating it into the spaces where they are much needed to access and provide equitable healthcare. One of the last items that we have here, or the last item I think it is the scap fix device. And these are scapular fixation plates. This is your shoulder blade, your scapula, basically this is this part. And what would happen is sometimes you'd have a fracture. So I think we've seen a lot of bullet-based fractures, and actually it's not this side, it should be this side, apologies. And what we find is that gunshot wounds, car accidents, the scapula fractures fairly easily. There are various techniques to put them back together, but one of the devices and technologies that could be used to assist with this was to develop these plates that could be fixated and drilled into the scapula to hold the various pieces together in a surgery. And these are modeled onto the scapula. It's 3D reconstructed into it, and you're actually able to then provide a device that's specific to the scapula outside of it being just try to put together in bits and bobs. So this is designed for this person, for the scapula, to fix it to something close to what it was before. So that's the scap fix device that we have here. And I actually left out a fun device that we've got. This is something that the students picked up as a fun project. This is a white cane. Basically, it's something that a person with visual impairment would use, someone that's blind, they'd use this white cane. And we all know, we've seen people use this cane before. It's stretched out in front of you, and they would scan and track the area that they're walking in. What the person with the visual disability approached us with, he said to me, I'm tired of driving an ox wagon. And we wanted to make sure that he starts driving a Ferrari. So how did we do that? We looked at making use of these ultrasonic sensors. And the ultrasonic sensors is able to determine distance, and it can track what's in front of somebody. And we fitted it out with these vibration motors here. So this is a very rudimentary put together. This is a proof of concept. And we've put these vibration motors on it. And if you were able to feel it, you could actually, with me holding it in front here, it's actually vibrating and telling me that there's something in front of me. If I have to scan across, it's telling me that there's something here, and I can close my eyes accurately saying where these things are around me. And the person, when he looked at this concept and saw us try it, he said he can't wait to get his hands on it. But this is just a proof of concept device coming out of one of our latest spin-off called HealthShot, where we look at actually taking some of these technologies and giving it a shot. That's a take on the lunar landing, the moonshot program. But how do we give health a shot? How do we look at some of the problems that people are experiencing in everyday communities and everyday life? And how do we provide them with technologies that they can actually provide access at a fraction of the cost? That's sort of a next to nothing cost if we could. So if anyone's trying to get hold of us, I think we've got a nice contact profile and picture coming up on your screen. But we're based at the Medical Devices Lab at the University of Cape Town. We're on med school, so you're welcome to reach out to us directly at med school. We also have an email address called medicaldevices@uct.ac.za, and you can find us as UCT MedTech on various social media platforms, Instagram, X, Twitter, and especially LinkedIn. We post quite actively on LinkedIn, so we hope to see you there.